Welcome to MyHealth AI, a new technology that solves a range of problems for clinics, hospitals, and ACOs, like the need for additional revenue due to tight budgets and razor-thin operating margins, limitations in scheduling due to patient backlog, increasing numbers of patients with chronic conditions requiring ongoing care. In fact, 39% of Americans, or 129 million people, have at least one chronic condition, and that number continues to rise. In addition, MyHealth AI addresses the lack of oversight by both practitioners and chronic condition patients, where shortfalls in monitoring of their day-to-day health are leading to unnecessary hospital visits and healthcare incidents. These gaps in patient care result in costly and intensive treatment episodes and drain healthcare system budgets. Another challenge healthcare providers face is the inability to actualize the full revenue potential of their patient base due to A, limitations in time needed for patient outreach and monitoring, and B, the daily patient visit limits that a physical clinic is constrained by. Now, this drainage of healthcare budgets, ineffective patient monitoring, and lost clinic revenue can be resolved through the effective use of remote patient monitoring, also known as RPM, and chronic care management, or CCM. Clinics can provide better care for chronic condition patients and reduce burdens on the overall healthcare system due to emergency incidents, all while significantly increasing their monthly and annual billable income through their existing patient database. MyHealth AI has been the game-changing RPM solution to actualize this vision. Our technology provides better care for patients with chronic conditions and significantly increases found revenue for clinics and healthcare providers. This revenue is sourced from their existing patient database, not through the costly process of finding new patients. Our RPM model also saves insurance companies money by reducing unwanted and high-cost hospital visits. MyHealth AI actualizes these benefits to patients and clinics without requiring additional staffing or time from existing clinic employees. We accomplish all of this at no cost to healthcare providers or facilities, and at no cost or little cost to patients, depending upon their copay. What does MyHealth AI do? Well, MyHealth AI incorporates proprietary AI technology to provide RPM for chronic condition patients and simultaneously generates CMS-approved, audit-ready reports and records to increase clinic revenues. As stated previously, this is all accomplished while requiring minimal input from existing clinic staff and resulting in a dramatic increase in new revenue. Here's how MyHealth AI works. Our medical director or clinic partner scans your EHR database looking at ICD-10 codes to identify patients who qualify for either A, RPM if they have one chronic condition, or B, CCM, chronic care management, if they have two or more chronic conditions. Our virtual medical assistants, or VMAs, reach out to patients by text and/or phone call to let them know that they can receive RPM or CCM services at no cost or little cost to patients. Note, our platform is synced with the clinic phone system, so patients can trust that communication is coming from their doctor. Our team of VMAs then speak individually with each interested patient to get them enrolled. We have a business associate agreement in place with the clinic that protects the integrity of this process and ensures HIPAA compliance. We send patients the equipment needed for RPM and/or CCM, remember, at no cost to patients or partner clinics. We provide FDA-cleared, medical-grade Class II devices, which are the highest-grade medical devices available in the U.S. today. Examples include pulse oximeters, blood pressure monitors, blood glucometers, BMI and weight scales, infrared thermometer, wireless pill boxes, and more. All the devices we use are pre-coded to sync with our cellular gateway and mobile app for real-time, seamless data collection, and EHR integration. After a patient receives their RPM devices, our VMAs call the patient and train them on downloading the MyHealth AI app to their mobile devices, using their RPM devices, syncing their RPM devices to their app, and providing the patients their schedule for using the RPM devices moving forward. Once onboarding is complete and their equipment is connected, it's easy for patients to use MyHealth AI independently. Our technology will alert the VMA of any missed usage, so they can follow up immediately to encourage the patient to complete their diagnostic monitoring as per their recommended schedule. Each time the patient takes a reading with their RPM devices, the information is automatically 256-bit encrypted and sent to the cloud with full HIPAA compliance, where it populates the patient's record in the clinic's EHR system. We've incorporated over 60 EHR systems into the MyHealth AI platform, including the popular systems such as Epic, Athena, Allscripts, Meditech, eClinicalWorks, and more. That means no costly or time-consuming custom integration work for clinics. Our AI technology is constantly analyzing the latest diagnostic results provided by patient RPM devices. If any results are trending outside of normal and acceptable levels, alerts are sent to the VMA to begin early interaction and escalated to the physician, the patient, and to pre-authorized members of the patient's family. The VMA and/or the physician's medical staff can connect with the patient and review the data and discuss recommended steps to reduce the chance of an unnecessary medical event. Each interaction with the patient by phone or message and time expended reviewing patient data is timed and recorded. The total time consumed by the VMA, physician, or other staff members is tracked and used to calculate all billable minutes. For a doctor and clinic, these billable minutes are found revenue through CPT code billing. The system of RPM billing requires no in-clinic patient visits. This model is ideal for doctors and medical groups and provides better ongoing oversight of their patients with chronic conditions, along with efficient additional billable revenue. The MyHealth AI system generates all reporting and audit-ready interactions ready for billing with proper CPT codes required for physician reimbursement. The audit trail is ideally suited for CMS review to prevent any chargebacks. Now, as stated earlier, MyHealth AI operates with no costs or setup fees to healthcare facilities or their patients, and can generate a lot of new revenue for your clinic or hospital. With 39% of all Americans struggling with at least one chronic condition, our AI technology can identify many people in a clinic's EHR system that would be approved for RPM and/or CCM services, because our VMAs do all of the manual outreach and patient onboarding. Clinics do not need to hire additional staff or take on additional overhead costs. Our system seamlessly guides both doctors and medical staff to the patients whose data patterns warrant further review. MyHealth AI documents the time spent reviewing this data and optimizes the allowable billing automatically. Each month, after a clinic is reimbursed by Medicare, the clinic keeps 50 to 70% of the revenue generated by MyHealth AI billable hours, and 50 to 30% is paid back to MyHealth AI to provide the equipment, monitoring, and services necessary. It's a simple revenue share model. A clinic with 5,000 patients in their database, our services should conservatively be able to generate over $1.2 million in found revenue annually. As mentioned, this is additional revenue from your current patient base with very high margins because MyHealth AI handles the vast majority of the workload and equipment costs. This $1.2 million example is based on an estimate of only 30% of your patients being qualified for RPM or CCM. But remember, the data shows that actually 39% of Americans have chronic conditions. Now, as you can see, the revenue potential for MyHealth AI is significant with little to no extra effort or expense on your part. In closing, MyHealth AI provides significant found revenue for the clinic, provides better care for patients with chronic conditions, and improves health outcomes, all while providing a more efficient and scalable patient engagement for medical systems and a reduction in emergency-level incidents and unnecessary hospital visits. This includes costly hospital readmissions within 30 days of release, which has proven to be the greatest financial burden on our healthcare system. In short, we provide a game-changing win-win solution where everyone benefits. MyHealth AI is beneficial to all healthcare facilities. Whether you're an independent clinic, a medical group, a hospital system, or an accountable care organization, our technology will open a new chapter in expanding revenue opportunities and dramatically improved patient care. Contact us today to learn more about how MyHealth AI can help you.